that particular paper first, and then we'll go through the PowerPoint. Okay. All right. So okay, let me share my screen. Hold on. Yeah. Okay. So this will be the paper that I have selected. I when I've read the guidelines, right? I think your coordinator would like to have my paper, but just now I informed your coordinator because my paper usually the papers are on economics, those kind of things. So I chose another paper from my mentor, Prof. Kim Kamarul Imran Musa. He is also a public health physician, and he did quite a number of epidemiology modeling study, right? So maybe we can try to understand this paper first so that later when we go to the PowerPoint, I hope it will be easier for you. Okay. So about this paper, yeah, this paper is on time series decomposition and modeling of dengue cases in Malaysia 2022 to 2024. It's a nationwide observational study. All right. So by looking at this paper, I believe maybe some of you feels that the lingo, the terminologies are quite challenging, not familiar to you, right? Because I understand that you have heard about incidence, prevalence, odds ratio, relative risk, but now we are talking about a modeling language, which may be a bit challenging at first, but I think once you have understand it, you will fall in love with this lingo. Okay, but don't worry too much because today's session we are not trying to be a modeler ourselves, but instead trying to understand the paper and how does we interpret findings from this paper for our policy and decision making, right? So let's go through the abstract first. All right. So based on the title, actually, if you can see the title first, it's a nationwide study. So that means you understand that it involves all the states in Malaysia. All right. It from 2022 to 2024. So that means it has like quite a big data. It collected, it used 3 years data, and it's a multi-center studies. So you can imagine the size of this paper, right? So what is this paper trying to do actually? So actually this paper try to examine the temporal dynamics. You know, it's temporal, right? Temporal means time, temporal dynamics of dengue cases. So basically, in a simple word, they want to see whether there is a different timing of dengue incidents in Malaysia across different states or not. That's the simplest way to understand it. Whether, for example, in January, all the states will have a peak of dengue cases in January, or maybe some of the state they have in January, some of the state maybe in December. So that's the main aim of this paper, right? They just wanted to see, to examine, to explore whether there is a dynamicity of timing of incident of dengue cases in Malaysia across this 3-year data, right? And in doing that, they use a weekly dengue case. Maybe by now maybe you know that dengue is one of the notifiable diseases in Malaysia. That means if doctors, medical practitioners, if we encounter any dengue cases, it is a compulsory for us under the Infectious Disease Act 1988. It is compulsory for us to report to the higher authority about these dengue cases, because it's one of the compulsory disease or case to be reported to the MOH. Yeah, we have the e-notification, e-dengue surveillance system within 24 hours of the diagnosis. So we have to report. If not, we can be fined under that act. All right. So they use the weekly dengue case from the national registry. So all the data, even though you are from the private healthcare setting, you have to report it, you have to notify it, and all the data will be pulled, will be collected in the system. All right. So that's why they have the national registry. So they can pull out the data, the weekly data, and they want to see the trend, the trend or the temporal dynamics of the dengue cases. So at the end, they wanted to see the dengue incidence, like I said earlier, dengue incidence, and they wanted to actually see whether it's heterogeneous, it's different from one state to another, or it's homogeneous. The same pattern can be seen across states. So that's the main aim. And the results, they found that actually different state has different timing, and it is heterogeneous from one state to another. All right. So that's the reason why they have this conclusion. It's dynamic in Malaysia. We don't have like one trend can be applied across all the states, and so that's why the preventive measures has to be tailored to a specific state. All right. So I've gone through the abstract first. Later on, we will see one by one what can we see from the introduction methodology, so on and so forth. All right. Maybe I'll share another screen for my PowerPoint. Hold on. All right. So that is what I'm going to do. Sometimes I will share my the paper. Sometimes I'll share the PowerPoint. All right. So you are seeing my PowerPoint now, right? Okay. Yeah. Okay. Thank you. All right. So again, I'm going to repeat. Sometimes I'm going to repeat things that I have said earlier. So based on the paper, based on the abstract that we have seen, these are actually the objectives of today's sessions, right? We are going to see how the epidemiological concepts and the study designs are deployed in the actual healthcare research. So we are going to use dengue as a case. We are going to develop critical skills in reading. So when you read, when you try to understand the paper, you can deconstruct and synthesize a published epidemiological paper, which I hope it will be helpful for your group project. And finally, you can bridge the data to management. At the end, once we have the data, once we publish the paper, so what's next? How does we translate our findings into a policy or any decision making? So we can recognize how surveillance data, modeling output, and epidemiological findings directly shape managerial decisions, resource allocation, and health policy. All right. So before we go further in the paper, so we need to understand why dengue, why I chose dengue, why do we need to talk about dengue, why now? All right. So basically, dengue is a huge problem to us. From a public health point of view, we always had difficulty to manage dengue. It's like never ending problem to us. We did a lot of intervention, prevention, you named it, health promotion, but still dengue results in a huge disease and economic burden in Malaysia, right? But not only in Malaysia, in other country as well, as reported by WHO worldwide, dengue infection has resulted in over 360 million infection worldwide every year, every year. And in Malaysia, if we look at the data from 2022 to 2023 alone, okay, actually you can access to the data. You just go to the KKM website. They have like e-notification, e-data. It's not a real-time data, but you can pull out a bit of the data to see a statistics. So you can see a huge surge, very increase in the number of cases from 22 to 2023 alone, which was reported to be 86% increment from 2022 to 2023. And then this dengue also has causes 78% increase in the fatality, in the dengue death. Yeah, from 56 death the previous year to 100 fatalities in the next year, in the 2023. So a huge increase in the dengue death, and this death actually happened among the young people, those who is actually still productive. They should contribute to our economics, but then they died, they passed away because of the dengue. So again, dengue doesn't only cause a disease burden, but if you look at the economic consequences as well, it it gives us a huge impact in Malaysia, in other countries and worldwide as well, right? And why do we have to talk about this paper? Because again, this paper analyze data from different states, right? And as you may know, Selangor, where many of you may stay now, maybe a majority of you is from Selangor, are from Selangor. So Selangor is always a problem. Selangor itself recorded over 10,000 dengue cases at its peak in 2023 compared to the other the other states, right? So as a public health people, we have to think how to tackle this issue. If um we are stationed in Selangor, there is a way of managing dengue in that state. But what if we are maybe KKM decided to send us to Perlis, for example? So Perlis has a different trend, so we have to work differently when we are in Perlis. So that's how we can use data from this paper to understand what to do for our dengue cases in Malaysia, right? All right. So why this study again? Actually, we have talked about it. Dengue, most dengue data reported at national level only. So actually, before this paper came out, so this paper is quite recent. It was published in 2026. Before this, many modelers, they work on a national prediction or national projection. So that's the reason why we can predict in 2026, for example, in the whole Malaysia, we will have like how many fatalities, how many cases, so on and so forth. Rarely our local modeler works on the state level data. So this paper provides a good a new knowledge in which that they digest the information from the states level instead of national level, right? So again, it must before this, it must the important state level differences in timing and intensity, and existing models focus on a single city of districts, because as you may know, right, maybe you have learned about sample size. You in your research methodology, it's very difficult to conduct a nationwide study. So most of the researchers, they calculate a sample size, choose a sampling frame. They use sample to represent the whole Malaysia. So unlike this paper, they actually did collect data from all the states, yeah, which from the state they receive data from all the districts. So they collected all the data and they tried to analyze it, right? So until the paper came out, there is no state-specific forecasting tool existed in Malaysia. So Alhamdulillah, luckily we have that paper now. At least we understand the dynamics of dengue incidents from one state to another in Malaysia. All right. So the research questions that the paper has is, can we model state level temporal patterns of dengue in Malaysia to improve early warning system and resource planning? All right. So similarly, for your group project later on, if you are about to choose a study, a topic, you must choose a topic that you can establish the burden, the economic implication or the disease implication, so that you understand the clear disease burden and gap that you want to do in your research topic. All right. All right. So you have seen the title, right? So be- actually I was quite skeptical at first, because if you read somewhere in the introduction, no, in the methodology, you can see that the paper used a terminology of cross-sectional study. All right. Okay. Um, but if you look back at the paper, it is from 2022 until 2023. All right. Or actually, their weekly count 2022 until December 2024. Right. Include all Malaysian states, and then from the Ministry of Health. Right. So I would like you to be clear that, all right, some of the study, sometimes you have to interpret the terminology they use, with cautious, all right? When they mention a cross-sectional study, actually the cross-sectional study part refers to the data collection approach, So they cross-sectionally look at the registries from 2022 January till 2024 December. All right. But the time series itself is not a cross-section study, right? The time series is the analysis, they wanted to see the incidents across time, of various states. So when it's across time, it's a modeling approach. It's not a cross-sectional study approach. So you have to understand actually the design of the study is a cross-sectional or not. For me, if I can give a constructive comments on the paper, I would say that cross-sectional is this is the data collection approach, right? But the process, because they use a time series modeling and using secondary data analysis, I would call it as an observational longitudinal analysis, right? Because they wanted to see longitudinally when does the incidence peak at different states, right? But that is me. Otherwise, I have no other comments. I mean, the paper is published anyway. It's a Web of Science journal. So I think the author successfully explained that the cross-sectional is actually their data collection approach, and in the analysis, it's a modeling exercise, right? Okay. I'm sure you are familiar, right, with cross-sectional. Sometimes you have case control, cohort, So those are the different study designs in the public health study or epidemiology study. All right. So now, I'm going to hold on and my show and start to look back at this paper. All right, you're seeing my paper, right? So this is a common structure of a paper. They have introduction. I'm sure you are familiar with this. They have material and methods. Sometimes they call it methods only, methodology only, and then they have this analysis is part of the methods. They have these results, and finally they will have the discussion. Okay, discussion, all right? So let's go through one by one, all right? So and under introduction, basically, it's like the opening. I mean, the mukadimah, right? The pembuka bicara of a paper, they will talk about dengue in general, and then they will try to scope down and see in Malaysia how does it have problem or not, and then they will tell the audience, the reader, what is the important about this study, why they need to conduct this study, right? So if you can see, the author said that there are multiple factors contribute to the dengue transmission. You named it, right? Urban factors, human, weather, the mosquitoes, things like that, right? And in addition to that, we have some background knowledge that spatial means space or the area, the states, and temporal heterogeneity, differences in dengue across Malaysia. I think the author understand that looking at the registries, they can understand that some states has different pattern, and different incidence timing. So they wanted to see, to prove whether this is a right observation or not. Okay, so that's the reason why they want to predict the dengue incidence via a modeling exercise, right? Because like we have discussed earlier, many study before, they use national level. So when it's national level, sometimes it must, the needs for a better resource allocation for a state's level, yeah, the importance of state level difference. So that's the reason why they want to do a state level prediction of dengue incidence. So they use these methods, the LOESS, seasonal trend decomposition. So basically, we will look at it. How does this LOESS analysis? But this is just the analysis, I don't want to go further in the analysis because I think it's quite technical, but as a undergraduate level, you want to be like different from a graduate from other universities, right? So now, because of this advancement in technology, so we did a lot of prediction in our epidemiology study. So if you, even though you may not be able to conduct your own modeling study, but if you can interpret the paper that use a modeling analysis, I believe it's a achievement. Is a very good achievement. Not many of our students can can critically appraise a modeling paper, right? So basically they use these methods. They wanted to observe, sorry, the trend, the seasonal and irregular components, yeah, to see the incidence of the dengue, right? So again, they wanted to capture heterogeneity in temporal patterns because they wanted to provide support for different states on how to manage dengue, right? Okay, that's the introduction. And then the methods. So as we have looked just now, they said that it's a cross-sectional study, all right? If it was me, I will spell out to the reader saying that it involves a cross-sectional data collection, but this study designs use a modeling exercise, something like that, But as long as you understand that this is what the author write and what they actually mean, right? So they collect the data from January 2022 to December 2024 from the registry, which is maintained by the MOH. So this is the criteria lah. Not all the cases reported will be appear, in the registry. So there are officers at the MOH that will filter whether it's fulfill the checklist, whether we can classify it as confirmed dengue or suspected dengue, so on and so forth. So there is a work behind it lah. So if you understand, the registry is all the confirmed cases because they have to provide the lab data, the symptoms, those kind of things, right? So again, the study area, they involve all the states, yeah, of course all the federal territory as well, which the data from the states came from the districts. So there are this number of districts, right, across Malaysia. All right, so if you understand the analysis, this is the formula that they will try to analyze from the data. All right, this is the algorithm. So if you like mathematics, yeah, if you like statistics, you will enjoy this exercise so much as we do, right? So what happened is that this is Y, T, S, and R. Okay, all right. Okay. Let me go back to my PowerPoint. All right. So you are seeing my PowerPoint, right? So again, Y is the observed number of dengue cases, the incidence. All right. What is T? T is the trend component, whether you can see a trend or not. You can sometimes you can predict. For example, urbanization. So if there are many projects in that state, you can predict they will increase in the number of cases or not, right? Because the density will be increased, right? The population grows, so on and so forth. Whether there is a seasonal component. Seasonal means macam banjir, monsoon. So there are seasons. Kalau at the four season countries, we have the influenza, right? So influenza pun ada component of seasonal component. Yeah. So kita, whether it has seasonal component or not, and then the noise or irregular component. Irregular tu macam sometimes we have the outbreak. Sometimes people at the state decided not to properly manage their trash. They buang sampah bertabur-tabur, so there are noises in it, so they put that in their algorithm as well, right? Some anomalies. Okay, so you can imagine what the author did is that based on the data that they have collected, they try to see from that data whether because they have the weekly incidents, right? They know actually the incidents by week for every state or by month for every state. But now they try to see if they put some trend component plus seasonal component plus irregular component, whether they can predict the incident or not. Alright? Alright. So I hope we are clear on that. Okay. Again, this is the data source. They collect data from MOH, and it has to be confirmed clinically and laboratory. There are several criteria clinically, presence of temperature, rash, so on and so forth. So they collected data from various states, all states and federal territories. It's a weekly aggregated counts, and it is approved by the ethics, right? But now, if you try to appraise the paper, right? Okay, let's think about this. They tried to predict the incident based on the registry only, right? Registries only. So can you imagine, we can't even, we are the, perhaps from the Ministry of Health, from the Public Health Department, we can control our doctors, Some of the GPs, doctors at the private clinics, because filling up the form is actually quite a work, it's a lot of things you have to complete for you to submit for you to notify the case. Sometimes the doctors, they refuse to do that. So instead of diagnose a patient with dengue fever, they will only write a viral fever. Viral fever is not notifiable. You don't have to notify a viral fever. But once you establish a dengue fever, you have to notify. So that's what a lot of GPs are doing now, Sometimes they will give excuse that they don't have like lab facilities for them to confirm, they don't have the screening kit. So they will actually, you will know, if you have experienced a dengue patient, this looks like a dengue. It's very unlikely of influenza, leptospirosis, those kind of things. So you actually can judge a patient clinically. But then there are still many underreporting, because our doctors, they do not notify. Sometimes also, because I have experience working in Sabah, and other rural areas like in Taman Negara Pahang, sometimes not that we don't want to notify, but our facilities, our human manpower are not adequate, so it's very difficult for us to report, so that could contribute to the missed case or underreporting as well, right? Sometimes of course we are human, we misdiagnose, we misclassify the the disease. We notify, but then again, the officer who filter the cases, maybe they made a mistake, they misclassify the disease. Again, private clinic may not be in registries as we discussed earlier, and we have missing values, duplicates, so on and so forth. So if you work on a registry, these are the limitation, these are the challenges that you have to be aware of. Okay. Unlike if you have the control, if you can collect your data primarily, then you might minimize these biases, right? All right. So again, talking about biases. So again, because it's a registry based data collection, right? So there are possibilities of information bias, underreporting, misclassified as mentioned earlier. And if you remember the algorithm, the analysis, the prediction, they only include trend, right? Seasons and irregular noise, But as we have talked very early in the lecture, dengue is a very complex disease, Rainfall contribute to also the incidence of the dengue. Temperature, sometimes you can't control it, it just appears. So those are the confounders, may or may not be included in the analysis, right? And they only captures what they can collect, the temporal pattern, the timing pattern, not the causal relationship. So they're not sure whether it is significantly associated or not between the urbanization and the dengue incident at that particular time, at that particular place or not, So those are many confounders that beyond the this algorithm or this prediction. And then again, if you remember, they use the LOESS methods to predict, right? For them to check their prediction. So that's what we always do as a modeler. We predict and then we have to see whether our prediction model is good or not. Yeah, we call it model fitness. Whether our model fit or not. So in this case, they use this Arima-Sarima model. Arima and Sarima, no doubt, it's a good way of looking at the model as well. But statistically, we have to assume that the data is normally distributed, So sometimes if most of the time our health data, we have outliers. So there are some challenges to manage outliers with the Arima-Sarima model. And then they also check back their prediction with a real data by using these methods. You don't have to know it, which they try to do this because they want to address all the biases. They hope that by doing this, they can address all the biases, right? So what's next? All right, so let's go back here. Oops. Oh, okay. I have to stop sharing. Okay, and show. Okay, never mind. All right. So can you imagine after they have do the analysis? Okay, this is the finding. Yeah, this is the finding. Can you see? They found that they were right. They were right. Their hypotheses were right. Because different states have different peak. Can you see? Okay, let's go to Selangor. So Selangor let's compare to the neighboring country, the neighboring states, the Sarawak, right? Selangor always on the higher side, This is 2022, this is 2023, this is 2024, and this is the prediction 2025, Can you see Selangor? Always on the high, higher. The peak is always higher compared to the neighboring countries. Yeah, and if you can see Sarawak, the peak is here, right, somewhere in 2024. But in Sabah, can you see the peak is in 2023? Also in Penang, it's 2023. But if you can see in Malacca, it's very down there in 2022, right? So it has different patterns, different trends, different incidents peak across different states, right? Yeah. And then they wanted to also see what contributes to the incidents. Is it the trend only, or is it a season only? All right. So this is a heat map. So the higher, the darker the color shades, the shades of the color, the higher the strength. So you can see that, for example, mm, yeah, this would be better. Selangor, the trend is 0.8, was 0.835. That means most of the dengue incident in Selangor, the wattage, the incidents happen because of the trend. You know, so that means, for example, the trend is something like, for example, festival. So you know, if there is a Chinese New Year or Hari Raya um, festival coming soon, so you have to, the state have to be prepared, because more people will come to the states, you know, the density, the population density will be increased. So sooner or later there will be a dengue incident. That is Selangor, right? But can you see that patterns or that trend in the Perlis? No. It's very low and compared to the Selangor. Yeah. So in Perlis, regardless, for example, if there is a festival or urbanization or concert or what kind of trend, the contribution to the incident is lower compared to Selangor. But if you look at the Kelantan, most of the incident, in fact, the highest incident, because of the seasons. So that's the reason why in Kelantan, if you read the newspaper, you see in the Facebook, you know, most of the dengue will happen after the banjir season, after the flood season. Yeah. So this is the advantage of doing this. So you can know when will the incidents happen, so you can prepare the states accordingly. All right. All right. All right. So again, yeah. So what's the key finding again? So in Selangor, always at the highest peak, Selangor is always the champion for dengue. Yeah? So my students, most of them working in Jabatan Kesihatan Negeri Selangor, they always have a headache because they have to manage the dengue throughout the year. You know, but in Kelantan, usually the strongest during monsoon-driven seasonal pattern. So you can predict, yeah, the peak, the incident dekat Q3, quartile 3 of every year, yeah, during the banjir season tu. Yeah, kalau kita tak ada, if we don't do it for Selangor, for Kelantan, for every state, we will use this national data. Yeah, kalau kita use national data, we will miss this impact, yeah, of the incident at Selangor dengan Kelantan, but it occurs differently. Okay, so that's the reason why this is very important. Okay. So again, as a health manager, how are you going to interpret the findings? You can say that in Kelantan, the epidemic peak will occur somewhere in July to September. Yeah, so community will face a surge aligned with monsoon rains and breeding sites flood, then stagnant post-rain, and a healthcare manager can plan for this. So it's seasonal, not random, right? So you have to prepare. Once the banjir is almost happen, you can prepare your healthcare facilities in Kelantan to receive quite a number of dengue patients. Yeah, you can start to purchase the supplies, consumables, you know, start to prepare your wards, yeah, because you are about to receive many dengue patients in that month, right? But in Selangor, because it's trend, right? I mean, seasons does not contribute much of the epidemiological curve or the incidence in Selangor. So it's year-round transmission with no strong seasonal peak. because of the urban breeding side, the construction side, so on and so forth. So a healthcare manager in Selangor needs to sustain, because they will receive patients throughout the year-round transmission. As if there is a festival, the number will increase. So what they need is they must have a sustained capacity. They can't predict through season. It's a sustained capacity so that they can manage their resources accordingly. All right. Yeah. So again, based on that paper, what should healthcare manager do with this? So you can put enough resource allocation. You can prepare for your vector control strategies. You can plan for your beds. Especially in the seasonal states. In Kelantan, so you can open up more wards for dengue cases, and you can activate your early warning system. So just to share with you, from the data to decision making, so they have a weekly registry data, right? They forecast. Once they know the pattern, the trend, they can trigger the when it's go beyond the threshold, they can trigger the alert for that states to prepare, and they can make a decision. Decision in what? In vector control, hospital preparedness, and community engagement. Right? Yeah. But then again, there is no perfect study. So this study has a limitation as well. So again, underreporting as what we have mentioned earlier. And in fact, it's actually a short study period, only 3 years. Yeah. And it started in 2022, just a post-COVID era. In 2022, based on our observation, the number of cases was still not stable yet in 2022, because there is still an impact of the COVID-19. So we're not sure whether 2022 reflected a real scenario of dengue case in Malaysia or not. But that's okay. They've done that, so they can see a pattern of it. Of course, it's a univariate model, univariate, right? So that means there are many other confounders, as we've mentioned earlier, which can contribute to the incidence of the dengue cases. And they also use these models which assume linearity. Health data, usually they have outliers. So yeah, so this is the limitation of the study. All right. So from these papers, what you can see in the abstract, they summarize, right? They summarize the design, the findings, the implication. So if you are about to write your own abstract, you should follow the same format, right? You must tell the audience. Abstract is the we call it macam mana, first impression, So you must sell your idea. This is a very important. What is the method used? Yeah, what's the findings, so on and so forth. So in the introduction, they establish the burden. They tell us the research gap, they give some background and some burden of disease. In methods, you have to tell your methods, your study design, perhaps your limitation. You can critique also your design. And the results, you have to be honest, transparent with your results, tell what you found, and then maybe you can start off with some descriptive and go further with your results and the discussion, okay, the implication. So just some tips from me to you if you are about to do your research project. So people will be attracted if you anchor your study with the local data. If you give some introduction about Malaysian statistics, usually Malaysian, especially when researchers from Malaysia, we will get excited. We want to read more about your paper. Yeah. And you don't just report, you must interpret. Yeah? You don't report. For example, the just now, right? The trend was 0.873. You must interpret, help the readers to interpret. What does the 0.8 mean? So it's on higher end or lower end of your heat map, for example. Be honest with your limitation and tell us. So what's next? So now we have the data. What's next? What are the implications of your finding? diseases. All right. Yeah. So, as a closing reflection from me, just think about it. You don't have to answer. I also don't have answer for. I didn't prepare answer for this. So, for example, let's say now it's December 2024. All right, and maybe one of you works at the Selangor, another of you works in Kelantan, for example. And in Selangor, your model projects a significant dengue surge in January. And then you have this 500,000 budget. So where do you put it first? You know? So this is how usually health economists work. Yeah? We have the incidence data, we predict the future burden, and with the resources, with the budget that we have, how are we going to allocate it efficiently? Yeah? So usually epidemiology, public health people, health economy, health finances. So we will work together because at the end we wanted to reduce the disease burden and the economic implication of a disease. Right? Yeah. So that's about it from the paper, from the PowerPoint. Actually, the paper, I think the paper is very nice. Okay, of course, this is quite technical. You don't have to really understand it, but the main message is about the heterogeneity in the trend and seasonal component across states in Malaysia. All right. Okay, so that's about it. So I think I can stop presenting now. So any question from the floor?
Any question from the student? Rasanya tak ada soalan
Alright, okay.
Tapi saya ada satu soalan rasanya. Because this paper is very interesting. Dia basically this paper highlights the importance of moving away from national aggregates to state level data, state level analysis. Cumanya kan ada situasi di mana apa ni kiranya orang yang bekerja daily commuting dari macam contohnya Selangor, Kuala Lumpur. So mungkin susah untuk kita capture. Adakah kita capture infection ni di Kuala Lumpur ataupun di Selangor untuk kita data ni. So dari perspektif modeling, rasanya how much accuracy do you think we lose by keeping the states time series completely isolated? So itulah yang kiranya saya tertanya-tanya juga. So bagi pendapat Dr. Amirah macam mana?
Alright. Thank you, Doctor, for the question. Interesting. Sebab actually benda tu also happening during COVID-19 cases, right? When we capture, for example, infection dekat Selangor kan, for all you know, they were from Johor. They came to Selangor for work ataupun to visit the parents. Suddenly they stuck there and the punya case tu reported in Selangor. But right, they are from Johor, for example kan. To be honest, for dengue per se, we haven't done any detailed analysis on that, but looking for from a COVID-19 perspective, when we try to do it with a PhD students, usually pergerakan population movement tu kita lose tak banyak sebab our people yang bergerak tu biasanya yang the productive ones because they have to move. Tapi again, that was in COVID whereby MCO was conducted. So leisure was not captured at that point of time. Only yang working people yang tu. It was reported that we lose around 40%, somewhere around 30 to 40% lah. But again, for dengue ni very challenging. Dengue itself is a multifactorial kan. But then again, usually in modeling, we try to capture that in our propensity score. We try our best to match as much as possible. But that's still a limitation of a modeling. yeah.
Understandable. Okay, terima kasih kepada Dr. Amirah kerana sanggup meluangkan masa untuk memberikan guidance kepada pelajar-pelajar UITM HSM 555 Managerial Epidemiology. So saya selaku resource person ialah kiranya amat kiranya berbesar hati dengan sumbangan Dr. Amirah. Okay, so kepada student 4A dan 4C dengan 4D, okay, please check your future for the attendance. Okay, so you may leave. Okay, kalau ada kelas, kejap lagi. Thank you very much. Okay, terima kasih juga Dr. Amirah. InsyaAllah kita jumpa lagi.
InsyaAllah. Thank you so much and all the
Okay.
best everyone.
Alright, kita tutup Mana ni Nur Arisa, Nur Syafa, Farihin, Khairul Syifa,